Because when we breathe in and out through the nose, we pick up a gas called nitric oxide. And nitric oxide was first discovered in the exhale breath of the human being in 1991. Nitric oxide is an amazing gas when it comes to our health. And of course, there's different sites at which nitric oxide is produced. It has a huge impact, of course, on the blood circulation. But when I'm talking about nitric oxide here, I'm going to isolate it to the airways. So nitric oxide is much higher in the nose and in the paranasal sinuses than it is in the lungs. And if you breathe through your nose, you carry many more parts per billion of nitric oxide from your nose into your lungs than if you breathe through an open mouth. Because if you breathe through an open mouth, you're bypassing the nose and you're not getting the benefits of this gas, nitric oxide. So every breath that you breathe through your nose, you're carrying nitric oxide into your lungs. And nitric oxide is a natural bronchodilator. It's helping to open up your airways. Nitric oxide is also helping to move blood and improve blood circulation throughout your lungs. So this enables for a better gas exchange to take place. Nitric oxide is sterilizing the incoming air. Nitric oxide is vasodilating, so it's increasing and dilating the smooth muscle in the blood vessels, the capillaries in the lungs itself. So with nitric oxide, we can improve gas exchange. With nitric oxide, we can help to open up the airways. Now, another aspect, of course, is if you're a pulmonologist and your interest is with people with asthma, of course, if your patients persistently mouth breathe, which many of them are going to do, because if you have asthma, you don't just have inflammation of your lungs. That inflammation can travel from your lungs up to your nose, and of course, vice versa. So researchers talk about this unified airway. You know, we aren't talking about two different airways here. Your nose, the back of the nose where it meets the throat, the nasopharynx, your mouth where it meets the throat, the oropharynx, you've got the pharynx, you've got the trachea, you've got the bronchi, you've got 16 branches of airways. These are all conducting. And then, for example, from branch 16 to 23 is where gas exchange, because these small little airways, which are about 2 mil thick, they're pretty small. And this is where gas exchange. So the alveoli, the small little air sacs in the lungs, are positioned from the 16th branch to about the 23rd branch, give or take. So if, for example, you're breathing through an open mouth, you're taking cold, dry, unfiltered air directly into your lungs. You know as a pulmonologist that many of your asthma patients are triggered by animal dander, by dust, by cold air, by dry air. All of these things can trigger the airways to narrow. And there's nothing in the mouth that helps to moisten the air or warm the air or filter air in comparison to the nose. What's in the mouth is your teeth, your tongue, your hard palate, your soft palate, the back of the mouth, your gums, saliva, etc. All of those things that are in the mouth are for eating, for drinking, and for speaking, and for social bonding. Nothing in there, nothing in the mouth for breathing. So even though as a pulmonologist, you're prescribing medication to your patients, it's also very important, of course, to help your patients help themselves. And you can do this by providing a breathing re-education program using the Buteyko Breathing Method to decongest, so the patient knows how to decongest their nose, talking to the patient about the importance of breathing in and out through the nose with correct tongue resting posture, talking to the benefits in terms of how your nose is protecting your lung health,